present about the healthcare systems in Mexico. My name is Wendy.
I'm Deborah.
I'm Sabrina.
I'm Kauai.
So here's a general overview of our presentation. We're going to be talking about the history of Mexico and the healthcare system, along with the description, evaluation, and emerging challenges of the healthcare system. So a little bit about Mexico. It's the largest Spanish-speaking country in the world. It's actually, the official name is the United Mexican States, which includes 31 states and 1 federal district. Its current population is 129.2 million people, which makes it the 10th largest country by population. A brief history: in 1521, Mexico was conquered by Spain, and in 1846, they engaged in a war with the US, which resulted in 50% of their territory being lost. And in 1864, they were conquered by the French. And in 1910 was the Mexican Revolution, which resulted in the death of 10% of their population. So before all this, Mexico was actually an advancing civilization until they were conquered by these countries, which resulted in the pause of healthcare reform and advancement in most of Mexico.
So I'll be talking a little bit about the business and economic environment. So since the 21st century started, Mexico has actually had a pretty stable political and economic environment, and this is because the Bank of Mexico, also the central bank, has the ability to control fiscal and monetary policy, and that increased confidence of the Mexican economy around the world. And one way that they've pushed for this is to increase manufacturing and exports. And Mexico is actually one of the most open countries in terms of free trade. And that comes with its pros and cons. Obviously, there is more corruption and trading of illegal goods. But in terms of the economy, it's really good for the numbers. For economic growth rate, it's only 2.6% on average for the past few years. But what's more impressive is their inflation rate for the last 18 years has been under 5%, which is a difficult feat for any country. This is just a quote that I wanted to show from the textbook. It highlights a vibrant Mexican middle class prospering and a political system that is really stable. But this really puts a positive spin on what Mexico is, because a lot of the people who live in Mexico aren't in the middle class and aren't prospering. I'll continue with the next slide. Poverty. So poverty is very prevalent in Mexico. If you look in the chart for 2014, 46.2% of Mexicans are actually living in poverty. And how they gauge whether or not they are in poverty is through the general law of social development, and they look at things like income per capita, access to health services, and social security, and so on. Mexico has been taking large strides towards less poverty, but what they've really done is move people from that extreme poverty range to a more moderate poverty range. So they're making a little more money, but still not enough to say that they're living well. And now I'm going to cover the brief history of the healthcare system. So first, I'm going to cover the creation of health institutions, and then I'm going to talk about the healthcare report. And last, I'm going to cover the system of social protection in health. So in 1943, Mexico created some health institutions, like the Ministry of Health, the MOH, and the Ministry of Health is in charge of tertiary care, and they also do scientific research, and they also train specialists as well. And they are responsible for the urban and rural poor. And they, in 1943, they also created the Mexican Institute for Social Security, the IMS, and this gives health insurance to those who are working in the industrial workforce. And in 1960, the ISSSTE was created, and this gave health insurance to those who worked in the government. Although these social security institutions were created, they kind of didn't qualify, or half of the population didn't qualify for the health insurance. So this left around 3 million in Mexico's population that suffered catastrophic health payments because they had to pay their healthcare out of pocket. So therefore, in 1983, there was a healthcare reform because Mexico wanted to increase the quality and efficiency of their healthcare. So they tried to put more emphasis on first level care, technology, and community participation. But it took a while for funding, for Mexico to get funding. So finally, in 2003, Seguro Popular was established, and this tried to achieve healthcare for all. So the other half of the population who were uninsured before got health insurance from this popular insurance. So this also gave the bottom 20% of the income distribution healthcare, and it also gave their families healthcare too.
This video we talk about the public healthcare insurance in Mexico. The video is speaking Spanish, but we have subtitles, so please pay attention.
Historias con números que hablan. Cuando los Rodríguez supieron que su familia crecería, la abuela ya sabía que esta vez no tendrían que empeñar el coche para pagar las consultas y cubrir los gastos del hospital. Esta vez los Rodríguez, al igual que cualquier familia mexicana, sin importar en qué trabaje o cuánto gane, podrá recibir atención médica y medicamentos sin poner en riesgo su economía. Pero ¿cómo se hizo esto posible? Para proteger a las familias con menos recursos o sin seguro médico como los Rodríguez, el gobierno federal ha puesto el seguro popular al alcance de cualquier persona en todo el territorio nacional. Ahora ya nadie se queda sin atención médica. Mujeres embarazadas, recién nacidos, niños, ancianos y habitantes de comunidades de difícil acceso, todos pueden recibir atención de forma gratuita. 45.868.881 mexicanos, incluyendo toda la familia Rodríguez, bueno, casi toda, están afiliados al Seguro Popular y pueden dormir tranquilos. Esto significa que la cobertura que alcanzó el Instituto Mexicano del Seguro Social en más de 60 años, al Seguro Popular le llevó tan solo 6, sin contar que muy pero muy pronto se alcanzará la meta histórica de cobertura universal en todo lo largo y ancho del país. Tú también, afíliate al Seguro Popular.
There have 55.6 million people insured by popular insurance in 2013. In 1990s, several national studies revealed that more than half total medical expense in Mexico were out of pocket. The reason is more than half of our population, they don't have insurance. We have our first poll question. The question is, which institution was created to achieve healthcare of all in Mexico? We have 4 options. The first one is Ministry of Health. The second one is Mexico Institute of Social Security. C is Seguro Popular. D is ISSTE. Since most of people choose C, and the correct answer is C, Seguro Popular.
So I'll be talking a little bit about the description of the current healthcare system. This is a chart taken from the textbook, and it really breaks down the public sector from the private sector, as well as how it's funded, the organizations that are affiliated with that particular part of the sector, as well as the services and the people who are eligible. So for example, we're looking at Social Security, so the very first column. It's funded by the government, and IMSS, that Sabrina talked about previously, is part of that. And if you want to know something about the public sector, they have mainly general hospitals, so the hospital care that they can receive is more on the general scale, clinics and services as well. And their employees and their families have access to this particular insurance from this organization. So the Mexican healthcare system is actually broken down into 3 subsystems, and that is Social Security, Social Protection System, and health, as well as the private system. So now I'm going to talk about the Social Security, and this is a part of the public sector, and it includes institutions like Pemex, which gives insurance to oil workers, Senda and Semar, which gives insurance to the armed forces. So the Social Security institutions own and run their facilities and employ their own staff. And like Deborah said, they're financed by the government, employer, and employee. And the Social Security system not only offers health insurance for those who qualify, but they also give unemployment insurance, disability insurance, life insurance, and also retirement benefits as well. And they also cover pharmaceutical and medications. So in the public sector, it's complex and fragmented because the healthcare you qualify for depends on a person's work status. However, they're working towards a greater efficiency, but the private sector is growing at a steady pace to fill the gaps that the public sector does not offer, which is the demand for faster and better care. And the private sector is mostly funded out of pocket payments. And the public sector even though the public sector has less hospitals than the private one, it has more of the bigger hospitals. And like Deborah mentioned earlier, it's more of the general hospitals.
Now we are going to talk about the evaluation of healthcare system. According to the OEDC, the total medical expense in Mexico is 6.3, and per capita expense of health is $1,048. This one is below the 9% GDP of OEDC countries, and the per capita of $3,450. For example, there was 2.4 nursing per 1,000 population in Mexico, below the average 9.1 of OEDC. And in 2014, Mexico had 1.6 hospital beds per 1,000 populations, and compared to the OEDC have a 4.8 hospital beds per 1,000 populations. Also, the quality of healthcare is a permanent challenge in Mexico. Serious problem is with waiting times causing surgery to be cancelled, and private and public facility was subject to formal and accreditations. So hospital and clinic can review and certify that they are maintained as a good standard of care. Also, an improvement of service delivery, access to job, and waiting time of ambulatory care.
So in terms of access, the Mexico health institution is segmented into 3 categories of beneficiaries. The first one are workers of the formal sector of the economy and retired people and their families. So they're covered by the Social Security institutions that we mentioned earlier, IMSS and ISSSPE. And the second are the self-employed workers of the informal sector of the economy, including the unemployed and their families. So they're covered by services from the MOH. And the third are the population with the ability to pay. So they include mostly upper and middle class individuals who have private health insurance. So in order to increase healthcare access, the system of social protection and health extended public health insurance. So in 2000, about 45 5.6 million, which is like 45% of the population in Mexico had health insurance, but in 2013, 55.6 million people were enrolled in the popular insurance. So the hospitals and medical services associated with the popular insurance provided treatment and drugs for diseases such as cancer and HIV or AIDS, and the uninsured had limited access to those benefits, especially in the rural areas where they had limited access to ambulatory care and outpatient services. But on a more positive note, public health services are provided by the MOH to the entire population, regardless if they're affiliated with any health institutions, but they only provide basic health services such as vaccinations, health promotion, and disease control. And this is our last POEB question, which is about the previous slides that we talked about. Which element of healthcare do you think Mexico lacks the most? So you just click on one of them. And it's an opinion-based question, so there's no right or wrong answer. Okay, I'm gonna lock it. So most of you guys chose quality and access. Maybe because access is bad in rural areas in Mexico, and they need more people need to have access to ambulatory care and services. And quality also plays a role because the medical services or medical clinics lack nurses.
Alright, our last thing is the emerging challenges. So, summarize all of this. So, the first challenge is a challenge for any country, not just Mexico, which is the appearance of non-communicable diseases. And this includes cancer, medical illness, and or mental illness, and other sorts of like diabetes. They're all very costly to treat and to find solutions for, which is why it's always a challenge. And another thing is the government has to find a balance between public health activities as well as personal curative cares. And that's finding more general or more specific ways to help people. And another thing is quality of care. There's always an expectation to be better, to improve with technology as well as a booming economy. If you can't improve all these things, then why can't you improve healthcare? And another thing that we all mentioned was the difference between urban healthcare as well as rural healthcare. So people who live in the rural areas do not have access to hospitals and services that they need. And Mexico should really take steps to mitigate that difference and try to find a balance between the two. Next, we're moving on to our active learning. It's going to be sort of a Jeopardy style. We've all given you guys Post-its of different colors, so find the people with your same color Post-it. They should be like sitting around you. There's going to be a prize at the end, so you guys should all participate. So the people with the orange Post-its, you're going to be the lemon, and then the people with the green Post-its, you're going to be strawberry, and then on the yellow, you're going to be the banana, blue, you're going to be the pear.
So you guys don't have Post-its, there's seats in the front that are empty.
And pink, you're going to be the apple.
You guys are orange, so you're going to be the lemons. Anybody confused about what fruit they are? Yes?
We just raise our hands.
Either discuss the group.
It's based on our presentation, so I hope you guys paid attention.
Yeah, you guys can raise your hand.
Or pull up the slides.
Yeah, so if you win, you win a prize from the whole group. So take initiative. All right. So we'll start with the lemons. Orange. Choose.
History for 300.
Okay, so how many people were insured by Seguro Popular in 2003?
55,600,000. And that is the answer. Alright. We'll move on to the strawberries. You guys have a choice about what you want to choose? Strawberries are the people in the top two.
Anyone?
Just choose a question. Like anything.
Call the person.
Annie. What?
Which institution tends the need for the industrial workforce?
Anybody can answer for any group.
You can pull up our slide.
INSS.
Yes.
We're not strawberry.
Oh yeah. Oops. All right. Next, bananas. I think it's the blue ones. Right? No. Wait, is that the yellow? Yellow. Banana. Guys have a preference or questions?
What is the capital of Mexico?
Alright, moving on to the pears, blues. Choose a question.
100 sectors.
Which sector is complex and fragmented?
There's only two possible answers. Public or private? Yes. 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 Alright, moving on to the apples. Just choose a question. Sector's 300. Ooh.
Why is the private sector growing at a steady pace? Anyone? Yeah, anyone can answer.
Alright, have 8 seconds. Alright, we can just see the answer. So, they really fill the gaps that the public. Oh, do you want to answer? Oh, sorry. So the public sector is really lacking a lot of coverage for other people, so the private sector covers. Moving back to the lemons.
Institution 300.
Which institution was created to achieve healthcare for all? Yes, correct.
Alright, strawberries.
Do the dependents qualify for IMSS? It's a yes or no answer. Anyone want to take a guess?
Alright, the pears. Yes. Okay, moving on to bananas, yellows.
What year was Seguro Popular established?
Give it a good guess. Yes?
Yes.
Yeah, you guys are 11. Huh? Oh, anybody can answer.
Jeopardy.
Oh, we're just doing anybody can answer. Yeah. Alright, last one.
Which sector requires patients to pay mainly out of pocket? It's either private or public.
So the lemons will get chocolate because you guys won. So does anyone have questions? No? Okay, thank you for listening.